Today we're going to talk about 4 common types of headaches: migraines, tension-type headaches, cluster headaches, and medication overuse headaches. Let's start with migraines. Migraine is a hereditary, inflammatory disease, and it can affect people in different ways, even within the same family. The difference in experience is due to multiple genetic predispositions that determine how sensitive an individual's brain is to various triggers. Common triggers for migraines include hormonal fluctuations, dehydration, skipping meals, significant changes in sleep patterns, rhythm changes over the weekends, alcohol consumption, and psychological factors like both positive and negative emotions. To diagnose a migraine, we look for specific criteria. At least 2 out of these 4 must be present: a moderate to severe headache, unilateral pain, a pulsating or throbbing sensation, and worsening pain with regular physical activity. Additionally, symptoms such as nausea, vomiting, or hypersensitivity to light and noise must also be present. A migraine attack can last anywhere from 4 to 72 hours. Now, it's important to note the difference between chronic migraines and episodic migraines. Chronic migraines occurs when someone experiences headaches on more than 15 days per month, with at least 8 of those days showing migraine features for at least 3 months of the previous year. There are 2 main types of treatment for migraines: acute treatment and preventive treatment. Acute treatment is all about finding immediate relief during an attack, while preventive treatment is initiated based on how frequently a person experiences attacks. For acute treatment, starting with non-steroidal anti-inflammatory drugs, known as NSAIDs, like ibuprofen, is common. A helpful tip is to take NSAIDs with coffee, as caffeine can enhance their pain-relieving effects. Additionally, there are triptans, which are specific medications designed for migraine relief. Using prokinetic drugs like domperidone along with NSAIDs and caffeine helps the body absorb them better. If someone experiences nausea or vomiting during a migraine attack, a pharmacy-prepared suppository that contains both NSAIDs and caffeine can be helpful. However, it's crucial to be mindful of medication engagement. Taking more than 10 migraine medications per month can lead to a medication overuse headache where overuse actually perpetuates the pain. Therefore, NSAIDs should not be taken for more than 15 days per month. Moving on to preventive treatment, a neurologist may recommend starting this when a person has more than 4 attacks per month or when migraines incapacitate them for more than 2 days. Options for preventive treatments include riboflavin and certain antihypertensives like beta blockers, which typically have few side effects. There are also antiepileptics like topiramate and valproic acid and antidepressants like amitriptyline and venlafaxine, though these may have slightly more side effects. In some cases, botulinum toxin injections given every 3 months can be an option for chronic migraines. Another promising choice is CGRP monoclonal antibodies, which can be given as monthly subcutaneously injections for both episodic and chronic migraines. It's important to remember that preventive treatments should be taken for at least 2 to 3 months and up to 6 months for episodic migraines, or even a year for chronic migraine sufferers.